Good day, panelists, fellow nursing students, and nursing research one professors, Dr. Shaila M. Shahara and Dr. Leslie E. Young. We are the Group 2A of Being 3B, studying the coping mechanism of nurses in overcoming workplace challenges. Allow me to introduce you my fellow researchers in the conduct of this study. Yours truly, Therese Cordova, Ramoncito Kua, Jerlene Guayna Esteves, Clark Harvey Filsilda, Kay Julian Flores, and Shane Nanado.
Introduction. Nursing is a challenging profession with different complicated demands and responsibilities in the work area. With workplace challenges, it can affect the nurse's physical well-being, emotional, and mental health. According to American Institute of Stress, stress is a major factor in up to 80% of all work-related injuries and 40% of workplace turnovers. Coping mechanism. This helps nurses adjust to pressure and stressful events and guides them to maintain their emotional well-being. The aim of the study is to discover the factors that contribute to the workplace challenges of nurses and coping mechanisms in the healthcare setting.
For the objectives, the study aims to answer the following question. So first, what is the demographic profile of the nurses when in terms of age, sex, and area of assignment? Second, what are the workplace challenges being experienced by the nurses? Third, what are the coping mechanisms used to overcome these workplace challenges? And the last question, are there any significant relationships between workplace challenges and nurses when they are grouped according to the demographic profile? Significance of the study. For the Bacolod City Health Office administrators and barangay health centers, they may use the results as a basis to respond to the problems and challenges faced by the nurses. So for the nurses and healthcare workers, they may use the results in identifying various coping mechanisms to cope with the different challenges encountered at work. For the nursing schools, clinical instructors, and nursing students, they may use the results as a guide in meeting the competencies that may help nursing students to overcome future workplace challenges and allow nursing students to be prepared from workplace challenges. For the future researchers, they may use the results as a reference or a guide in conducting their own studies.
For the theoretical and conceptual framework, this study was anchored by Roy's adaptation model. This model explains that a person has an adaptive behavior towards continuous exchange with the external and internal circumstances of the situation. This led to an understanding of the workplace challenges faced by the nurses and how they cope with the situation and foster a successful adaptation. For the schematic diagram showing the conceptual framework of the study, it is reflected from Roy's adaptation model, looking deeper into the coping mechanism and workplace challenges of nurses. It started in identifying the profile of the participants, then they will assess the workplace challenges they commonly encounter and reflect on how they cope up with these challenges.
Hypothesis. Null hypothesis. There is no significant relationship between the workplace challenges and nurses when they are grouped according to their demographic profile.
For our methodology of the study. For the research design, the study utilized a quantitative descriptive approach to gather the data. Survey research method was used to identify and answer the coping mechanism of nurses in overcoming their workplace challenges. A total of 50 nurses work in Bacolod City Health Office and Bacolod Barangay Health Center were chosen as the participants of the study. A non-probability convenience sampling was applied for data collection. They were chosen based on their area of assignment, availability, and willingness to take part in the study.
For the instrument, the design of instrument used to gather the pertinent data was a modified standardized questionnaire. For the validity, to ensure the validity of the questionnaire, the Good and Skates validity test was used. This was validated by one of our school counselors at the College of Nursing and two of the nursing instructors. Critic by the research instructor and research panels. The score showed 3.63, which interpreted to very good that is valid. For the reliability, to test the reliability of the instrument, the Cronbach alpha test was used. The result showed a Cronbach alpha of 0.917, which means the research instrument is reliable.
For the data gathering, first drafted and sent a letter of request to the health officer. Upon the grant of letter of request, lists of nurses under BCHO were asked from the statistic office of the institution. The researchers then contacted the close contact relatives working on the premises to aid in the easy communication, retrieval of data, and follow-up communications with the participants. The 50 participants answered the survey through the use of Google Forms, and due to unforeseen circumstances, limited nurses were able to answer the Google form. The researchers then opted to print out the questionnaire and gave to the participants. Finally, the data collected, retrieved, analyzed, and placed into findings, and analysis and conclusions were made.
For the statistical treatment, the descriptive statistics was used to describe the basic features of the data collected in the study. The frequency count is used to determine the 50 nurses' demographic profile, namely the workplace challenges and coping mechanism. The chi-square test of independence is used to determine if there is a significant relationship between the variables.
So for the ethical considerations, principle of non-maleficence, principle of autonomy, and principle of confidentiality were observed while conducting the study. So the participants were given the option to withdraw any time from the study. The participants' privacy was also ensured.
For the results and discussion, for the demographic profile of nurses, age belong to adulthood ages 31 to 35 years old, which is 34%, and 25 to 30 years old, which is 26%. This implies that most of the participants are of their mature ages who are capable of making prudent decisions. For the sex, female is 66% and male is 34%. For the area of assignment, mostly were assigned to the Bacolod City Health Office Room 1 or the Animal Bite and Treatment Center with 14%, and BCHO Room 102 and BCHO Room 101, which is the disease surveillance and COVID-19 results with 12%. The least were assigned to Barangay Sumag, Barangay Tango, Barangay Mansilingan, Barangay Punta Taytay, and Barangay Alias Health Center with 1% each.
For the workplace challenges, the results show that the breakdown of computers, which accounts for 20.93%, takes up the biggest part of this study. This is followed by relieving other units that are short-staffed, which accounts for 16.28%. The least workplace challenges faced by the nurses are both disagreement concerning the treatment of a patient and lack of opportunity to talk openly with other unit personnel about problems in the unit, which accounts to 2.30% each of the tallied percentage. This is correlated to Roy's adaptation model, which provides a framework for identifying variables that influence the nurses' responses to stressful situations.
So for the coping mechanisms used by the nurses to overcome the workplace challenges. So majority of the participants spends more time with their friends to relieve stress, which is 17.78%, and followed by doing their favorite activities and hobbies, which is 16.10%. So going further to the least used coping mechanism, least of them avoided overthinking and tried forgetting the problems that cause stress, which is 2.54%. So coping mechanisms of the nurses varies from each person according to the different variables.
Next is there a significant relationship between workplace challenges and nurses when they are grouped according to nurses' demographic profile? In utilizing the chi-square of independence, it presents that there was no significant relationship between workplace challenges and nurses' demographic profile at 0.05 level of significance. This shows that the null hypothesis of the study is proven to be true. This concludes that nurses are flexible to work through challenging issues like dealing with challenging priorities. This is correlated to Akbar et al. 2015 study that most nurses who can cope with the challenges have shown a positive attitude.
For the conclusion, the study concluded that nursing is a profession that requires various complicated priorities to foster quality care for the clients. With the responsibilities challenges faced by nurses, they developed their coping mechanism to adapt to these challenges. For the participants, most nurses belong to mature ages, but nurses that are at the age of retirement continue to work due to understaffing. Taking into consideration, a computer breakdown is the highest workplace challenges for nurses. With the coping mechanism of nurses when facing workplace challenges, spending leisure time with friends to alleviate stress is more preferable for the nurses to overcome workplace challenges. Nurses can easily cope and adapt to environmental stressors in the workplace despite their age, sex, and area of assignment, as there is no significant relationship between the nurse's profile and stressors. Therefore, it is important to address these challenges and prioritize every nurse's health, as it takes a healthy nurse to provide equally holistic patient care.
For the recommendations, is for the nurses to find their own ways to cope up with their workplace challenges. Next is for the BCHO and Bacolod Health Center to form a support group or assistance for nurses to help them. Next is for the BCHO Information Technology to provide nurses with less workload if the computer breaks down. Next is for DOH to take into consideration in having a bigger budget to hire more nurses so that they can have lesser workload. And lastly, for future researchers to include a wide range of hospitals or centers for a wider study.
For the utilization, study results will rely to DOH, BCHO, and nursing education. A copy will be endorsed to the Department of Health, Bacolod City Health Office administrators, and nursing education head upon completion of the study as basis for program evaluation. The data will also be available to serve as basis for various government agencies in helping nurses to cope with the mass of workplace challenges by developing a plan that finds relevant and worthwhile information to lessen the workload of the nurses.
Acknowledgements. We would like to acknowledge and give thanks to the following: Bacolod City Health Office and Bacolod Barangay Health Centers, Dr. Leslie Iyang and Dr. Sheila Trajera, Mr. Francis Biarneza, Jocelyn May Flor Cadena, Lorisita Antonia Chua, Ramon Clemente Martin Lachica, and the validators of our parents and most of all, our God.
Dear panelists and clinical instructors, the group is now ready and open for your questions. Thank you, more power, and have a good day.